You might be wondering what wealth has to do with COVID-19 vaccination. After all, these vaccines are free, right? Well, while that is technically true, priority access to vaccines is being acquired by healthy people who don't want to wait in line. In many countries, this means that the vaccination of people who are in the risk groups, such as the elder and frontline workers, is being delayed. At a larger scale, this situation is aggravated by the fact that the richer countries are buying and hoarding a larger quantity of vaccines, thus, leaving poorer countries fighting for scraps. The COVID-19 pandemic originated in early 2020 in Wuhan, China. Ever since, it has been making our lives a nightmare. The new normal originated by this pandemic has led to the imposition of strict public health measures and has negatively affected the economy, costing millions of people their lives and livelihoods. The first COVID-19 vaccine was developed and approved in record time, becoming available at a more general level in December 2020. In most of the countries, the start of the vaccination process coincided with the start of the year 2021, and, although we are still far from overspread vaccination, experts say that we might start seeing the beneficial effects of the vaccine in just a few months. However, the start of the vaccination process has also been accompanied by reports of abuse in the access to the vaccine. In most countries, priority access to the vaccine has been given to people who are a part of vulnerable groups. These groups can include people like frontline workers, elders and people with other comorbidities who place them at higher risk of contracting the disease or of developing serious side effects from it. In the early stages of vaccination efforts, wealthy people who are not frontline workers should be relatively at the bottom of the priority list. This is because wealthy people are one of the group of people better equipped to mitigate the transmission of the disease, by being able not to work and have groceries delivered to them, for example, and are also one of the groups of people who are more likely to survive by being able to access better healthcare services. Many wealthy people, however, have jumped in line of those most in need. A recent report by the New York Times suggests that, although New York State is levying heavy penalties for doctors who might attempt to help their wealthier patients to manipulate the distribution protocols, that hasn't stopped patients from trying, The Washington Post says. Wealthy people are likely to make the case to their physicians that they should be categorized as at risk to be prioritized for the vaccine. Those doctors are likely to acquiesce because they're responsive to many things: insurance plans that pay more, or, even better, cash payments with no insurance set rates, the necessity of referrals from high-value patients, or simply the discomfort of having to say no to someone who's used to hearing yes. Hospitals, dependent on big donors and those who pay them for special treatment, too, will make exceptions to get a few high-value individuals what they want. These exceptions will soon pile up to be the rule. We've seen this time and again. Wealthy parents, for example, are more likely to find health professionals to designate their children as disabled. In some rich school districts, children are 12 times more likely to be classified as having a disability than those in poor districts, giving them extra time on tests and thereby allowing them to perform better. Designing and then gaming the system is one of the perks of power. Although some might find this unacceptable, it is not something that should surprise us. Even before the vaccine, wealth, power and influence were already major factors in deciding who would have the best chances of survival. However, wealth and power also influence vaccine distribution in other ways. For example, in global terms, wealthy countries, representing approximately 14% of the population, have already been able to capture most of the vaccine doses produced by Pfizer and Moderna. These countries, as a group, also tend to be equipped with more healthcare by capita and have access to better medical facilities and equipment. However, vaccination seems not to be a zero-sum game, with some experts saying that nationalist motivations in accessing the vaccine might end up costing more than sharing vaccines, as it might help countries open up their economy sooner. To achieve this goal, The COVAX facilities were created as the result of a global cooperation to ensure fair allocation of vaccines to all countries. UNICEF has called for the richest countries to donate surplus vaccine supplies, and has also urged pharmaceuticals and manufacturers to make the vaccines available at affordable prices, the World Economic Forum has warned. While COVAX is a priority, vaccines alone will not end the pandemic. We need equitable and easy access to testing kits and treatments. We need continued communications and investment that support other practical prevention measures, such as physical distancing, mask wearing and hand washing. Additionally, there can be no effective trade-off between routine vaccination, essential health services and COVID-19 vaccination. All are essential to a sustainable recovery. Tackling one global health crisis cannot come at the expense of creating another. We would add here that it cannot also come at the expense of aggravating already existent inequalities. The vaccination process and the recovery from the pandemic will hopefully provide us with an opportunity to collaborate with each other and take care of the most vulnerable. Not only within our own countries, but also worldwide, there has never been a time so in need for solidarity. What about you? Have you been vaccinated already? Has there been reports of people in your country getting the vaccine ahead of their turn? Share your opinion in the comment section below, and if you liked this video, don't forget to hit the like button and subscribe to our channel to see more content like this.